A Wisconsin teenager who survived a suicide attempt is now helping educate lawmakers about the mental and emotional challenges a lot of young people are facing.
Yes, the person advocating with him every step of the way, his mom. Katie Crowther has more on this inspiring mother and son.
Shannon and Steve, together, they are raising the red flag that now, more than ever, families here in Wisconsin and beyond need support and resources when it comes to diagnosing and treating mental health challenges. I first introduced you to Carson last spring. The 18-year-old who lives near Green Bay uses his own harrowing story to help kids and young adults.
We didn't know if I was ever going to talk again.
Just 4 years ago, at the age of 14, Carson survived a suicide attempt. His mom, Amber, heard the gunshot and found him in the garage.
You search your mind, your soul, everything you have for what could I have done differently? What could we have done to prevent this? It led us to this platform to try to help in any way we can for other parents and families not to be walking in our shoes.
But their reach has expanded beyond families to government leaders who make national policy and funding decisions. Carson was one of 6 young people who spoke with lawmakers on behalf of children's hospitals around the country as part of Speak Now for Kids Family Advocacy Week. U.S. Senators from Wisconsin, Sen Baldwin and Ron Johnson, are among those who listened.
It was a really unique experience. They were interested in what I thought as a child who went through obviously these mental health issues, what I thought we could do better.
According to the World Health Organization, half of all mental health conditions begin by the age of 14. But the majority of kids and teens don't know to get help or how to receive care. The Mall family is making it their mission to change that. The mental health conversation should start with primary care providers at routine checkups.
Where kids feel safe to circle a number on a piece of paper, and for that door to be open to them to, boy, I see you're struggling in this area a little bit. Can you tell me more about that?
It's something Amber wishes Carson had been exposed to much earlier.
Mental health is treatable. Suicide is preventable. No family should have to go through this.
Suicide is the second leading cause of death among 15 to 19-year-olds, only behind accidents and unintentional injuries, according to the CDC.
The first thing we say is talk to your kids about mental health and suicide. Make those check-ins. Make sure that these are conversations that are happening often and fluidly, and be ready when your kids are ready to talk. It might not be when you are ready, but when they are ready, put down those phones and turn your attention to them so that they know that you're hearing.
One of Amber's biggest frustrations is the lack of professional resources to help. She says that's where leaders in government and the medical field must work together for solutions.
Our wait times for providers is not acceptable. And when we have kiddos like Carson out there banging the drum, telling kids that it's okay to talk about mental health and that they need to be open about their problems, then we as adults need to back that up with the appropriate services and resources that these kids need.
Amber and Carson often hear from families that have kids in crisis, stuck waiting a year to get an available appointment with a doctor or psychologist. The current supply of mental health professionals is not meeting demand nationwide. According to InSync Healthcare Solutions, of the more than 3,000 counties in all of the U.S., 60% have no psychiatrists at all.
That's really scary for parents, so I often get those questions of what should we do?
Amber and Carson are advocating to expand telehealth offerings, which became more mainstream during the pandemic.
It allows me to meet with my therapist, who is based 2 hours away from my home, a couple times a month, so I don't have to miss school. I don't have to miss track practice. A lot of people who are struggling with mental health are often too nervous, too anxious, too scared to go to a physical place and meet with a therapist.
But expanding telehealth will require lawmakers to address some hurdles, like the lack of access to technology among poor families and rural patients, and the challenge of maintaining full insurance reimbursement for telehealth calls. Until more solutions are reached and all kids and families have access to adequate mental health care, Carson will continue these important conversations, working directly with lawmakers.
That's something I would love to do in the future, and I'll do it as much as I can.
We reached out to Senators Sen Baldwin and Ron Johnson to find out what it was like hearing directly from Carson. Senator Baldwin responded, sending us a statement that reads in part, "We know there's more to do in expanding access to mental health care, eliminating the stigma around seeking help, and working to end the mental health crisis in our country. That's why I'll continue working to provide more resources."